He goes, well, you know, would you know the signs to look for in yourself in case you might need to get some help down the road? And as I said no, he pulls out of his pocket the business card of our employee assistance program, slides it across the desk, and says, call the folk over in employee assistance.
Hello, and welcome to the Hi-Fi Health News Podcast. I'm Erica Grotto. Senior citizens are at greater risk for depression than some other age groups due to common markers of aging, such as reduced mobility, chronic health issues, financial stress, and loneliness. But this group has low treatment rates compared to other groups of adults. Joining me to unpack this today is Adam Nemer, founder of Simple Mental Health. I talked a little bit about depression at the top of the podcast, but that's not the only mental health issue that older adults experience. What are some other common ones?
When we work with corporate customers, one of the most common challenges we hear from folk is how they're supporting their family members, their parents, their grandparents, their elderly who are going through life changes. And a lot of it is about dealing with loneliness. A lot of loneliness. One of the things that we heard from our last Surgeon General, loneliness is a scourge in our society. It impacts our cardiovascular system, right? So people who struggle with their loneliness, cause and effect depression. It's like smoking up to 15 cigarettes a day, right? Folks who struggle with depression and loneliness have 40% more higher likelihood of cardiovascular disease. And so this is a really significant impact on our elderly population, and there's a lot that we can do to help them.
What about substance abuse? Is that a common issue among seniors?
Absolutely. Absolutely. As much as we're breaking the stigma and getting there around mental health issues and mental illness, substance use, the stigma around substance use is still so much more stronger across all of our population. We as a society can do much more work at addressing the stigma related to substance use disorder.
You mentioned a connection earlier between mental health and physical health. And I want to unpack this a little because it seems something like chronic pain, something a lot of seniors experience, that can affect your mental health, dealing with an issue like that. But also dealing with something like loneliness can affect your physical health. Can you talk a little bit about that connection?
It's a vicious cycle. It completely iterates on ourselves. When our physical health impacts our mental health impacts our physical health. One of the leading causes for suicide outside of mental illness is back pain in America, right? Because there's so much pain that it can drive the physical pain, can lead into mental illness. One way that I like to describe this is to have you breathe through a straw, right? So, you Google, what does it feel like to have emphysema? They'll say breathing through a straw, right? What does it feel like to have depression sometimes? It's like breathing through a straw. So we get an audience to breathe through a straw. I was just doing this yesterday in Nashville. Had 70 entrepreneurs, everybody breathing through a straw. And when you breathe through a straw, it's hard to breathe. You start to hyperventilate, and you can feel your heart go faster, and you can sense how, wow, trying to connect this session to help people to feel that connection, to understand how can something in your head cause pain? Well, just trying to, if you're watching this now, go find a straw in your kitchen and start breathing through a straw and see how that feels. And as you start doing that, you'll start thinking differently, you'll start feeling differently, and they completely interact with each other. Interesting thing, it's not just heart disease. Diabetes, there's a 40% higher likelihood of diabetes, osteoporosis, even Alzheimer's disease.
Something else I mentioned at the top of the podcast is that seniors tend to be less likely to seek care for their mental health issues than younger groups. Why do you think that is?
It's a generational thing. The stigma. So here's so we know what it is. So just, I mean, and it's going to be unsurprising to anybody watching, listening to this, but 80% of people who don't get help for mental health reasons say that it's because of stigma. Until I went through my own personal struggles with mental illness and really understood it for myself, I wouldn't have been able to have made these connections, right? I had to, because I was raised in a society where that was based upon myths of mental illness and stigma and all that sort of thing. And so there's nothing that anyone's doing wrong. Our society just didn't educate ourselves now. Kids these days, they're learning about this earlier in life. And so it gives me a lot of hope and excitement for the future. Our next generation gets it. You want to know another interesting stat? This is from an organization called Mindshare Partners. It's a great organization out there. They found that more than 50% of millennials and 75% of Gen Zers have left a job in part due to mental health reasons.
Wow.
So we have the younger generation. They've just been educated in a different way. And so our opportunity here is to really, where we all can really help, is by talking with our parents, our aunts and uncles, our grandparents, checking in on them. How are they feeling? Spending time with them, going for walks. It's loneliness is a scourge amongst the elderly. It's a pandemic of loneliness, and that's something that all of us can do.
This wasn't something I wanted to ask you about, but you've walked me right to it. Because we're talking about, and we've talked on this podcast before about being a caregiver for a parent, an older adult. And that really takes a toll on the adult child as well. What are your recommendations?
Mental illness is contagious. When we're around folks that are struggling and we're helping them, if we don't take care of ourselves, it impacts us. You're absolutely right. It is so absolutely important. What's the first thing that you do in the airplane? You put the mask on yourself. If you're not taking care of yourself, you cannot take care of other people, right? So part of being a good caregiver and being a good support mechanism is you have to be taking care of yourself. And there's so many lovely things we can be doing for all of us for self-care, right? Just like we all have cardiac health, right? We all need to not smoke and not drink that much and exercise so we don't end up with cardiac disease, right? There's so much that we all can be doing to be taking care of ourselves and building our resilience as we're taking care of our loved ones, whether it's yoga, meditation, exercise, going for a walk, spending time developing, having close personal relationships with loved ones. You know what? Go to a therapist. Here's the thing that but that I did not understand again till I went through my own mental health crisis is this. And this is just, I feel so pedestrian and I'm embarrassed I'm about to say this, but it's like, I finally figured this out. I was 50 years old before I figured out, geez, if my tooth hurts, I call the dentist. I have Crohn's disease. If I have a Crohn's problem, I call my GI doctor. If I'm sad, I call my therapist.
You've alluded a couple of times to your own personal journey. Would you share just a little bit about your own experience in this area?
When I was 29 and getting groomed to run my family business, I found my dad after he died of suicide. And, my best friend, my business partner, and, the shame and the myths and the stigma back then were so strong that I really didn't get any help. I got an MBA, got married. I had a Forrest Gump like lucky executive career, CFO of a multi-billion-dollar healthcare system running a $5 billion insurance company. On the outside, it seemed like I had this dream life. On the inside, dude, I was one hot mess. I couldn't breathe. I was angry all the time. I was sick all the time. And I had no idea. And I was boiling and boiling for about 17 years. And then about 7 years ago, I found my mom after she passed away. And what happened in that moment is I had a complete emotional breakdown and had no idea. Started showing up at work wearing Levi's t-shirts. I shaved half my face. Oh, it was horrible. And I was mean as heck as everybody. And what happened is about 3 weeks later, a national Kaiser Permanente leader stops by my office and says, "Hey man, how you doing?" Like, "I'm doing great." He says, you know, uh, I know about you're fighting your dad's suicide now. I know that you just found your mom. Are you seeing a therapist? Is that why you're doing so well? I don't need to see a therapist, David. I'm doing great. He goes, "Well, you know, would you know the signs to look for in yourself in case you might need to get some help down the road?" And as I said no, he pulls out of his pocket the business card of our employee assistance program, slides it across the desk, and says, call the folk over in employee assistance. You should at least know the signs to look for in yourself in case you need to get some help down the road. I went and saw the EAP counselor the next day, and that's when they gave me the checklist, and I really crashed in this gentleman's office. And I got to that crucible moment in life when I had to decide what if I was going to ask for help or not. I over time, I left Kaiser and I started an organization to teach leaders how to have 5-minute conversations like David had with me. And that's what I do now.
I love that story because he did it in such a non-confrontational way. Because I'm betting maybe if he had come into your office and said, "I think you really need to see somebody," you would have said, "Nah, get out of my office," right? But he recognized the symptoms and knew how to approach you in a way that kind of took you to where you needed to be to recognize it in yourself. If anyone is watching and they want to know, what are those 5 things, and how do you recommend that people approach their loved ones should they, see some of these signs in them?
I'll walk through some key principles. But before I do that, I just want to educate your audience on a program called Mental Health First Aid. So, we all know CPR, we all know first aid, right? In the United States, I think it's credentialed by the American Heart Association. There's actually a program, it's literally called Mental Health First Aid. It's a program from Australia that's now across the world. In the United States, it's credentialed by the National Council of Mental Wellbeing. And it's the 3 million Americans have been trained on it. When she was First Lady, Michelle Obama became a mental health first aid trained person. And it is if you are interested in understanding and taking a short class and learning these things, go to mentalhealthfirstaid.org and sign up for a class in your area, and you can learn these in more detail. So that's number one. Now, when you take this class, they're going to teach you a handful of things. What are the signs and symptoms, and how do you approach them, right? Now, the signs and symptoms that what they're going to walk you through is there's emotional signs and symptoms. There's behavioral. You might see someone behaving differently than they used to, right? Changes in behavior. You might notice someone in the workplace is showing up for work late more often than they used to. They used to participate in a more open way, and now they're more reserved. They used to be more reserved, and now they're more aggressive. Somebody who looked disheveled, right? So one of my signs was I looked not well, right? My hair was getting that here. I'd shave half my face. I'm wearing t-shirts instead of a coat and tie. The interesting thing about when you take a mental health first aid class or a similar like program in mental health literacy, because there's lots of different things out there, is what you learn is that we as human beings were wired to recognize this stuff, right? So when you take this mental health first aid class and you go through the signs and symptoms, you're going, yep, yeah, of course, yeah. In fact, when we teach it in our workshops that we teach, we do it by asking the audience. We want to have a contest who can come up with the most signs and symptoms. And what happens is we all know these signs and symptoms because we're human beings. We just never were taught, hey, let's take the next step. How do we engage it? Right. And so the next part of what you learn in a mental health first aid class are how to engage somebody in a safe, caring, thoughtful, and non-judgmental manner. Right. So think about this. If 80% of people don't get help because of stigma, it's all about how do we engage somebody in a way that keeps stigma out of the conversation so that it's non-judgmental, so that it's asking, we're people who do this well. When you're engaging your loved one well, it's that you learn to be curious over problem solving. Here's my favorite one, and this is great. You might not want to say, hey dude, go see a therapist, because you're problem solving, but there's nothing wrong with saying, have you ever considered seeing a therapist? Right. So there's ways of framing words that are less judgmental, less open-ended questions. And so these are the tools and the language that you learn when you take a short class like that.
And if you are a senior who is worried about the cost of your mental health services, Medicare does cover many services, parts A and B, so inpatient and outpatient. Part D, the prescription drug plan, covers some medications. Part C is kind of a combination of all of those in a Medicare Advantage plan. You can be covered no matter what type of Medicare plan you have, so that's something to look into. That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.